I'm David Pariser from Norfolk, Virginia. I'm a voluntary faculty at the Eastern Virginia Medical School, and I'm in private practice there. My talk this morning was about hyperhidrosis, which is excessive sweating, and some of the new options that we have for treatment. Hyperhidrosis affects about 5% of the population, almost as much as psoriasis, but it's not something that's as uniformly recognized. If you look at the quality of life of people with psoriasis, measured by the DLQI, the Dermatologist Life Quality Index, it is the worst quality of life of anything dermatologists treat. Hyperhidrosis affects teenagers, adults, and children. And what we talked about today were some of the treatment options. We talked about antiperspirants, the newer clinical strength antiperspirants that are available. We talked about a new prescription product called glycopyrronium cloth, which is a topical anticholinergic. And antiperspirants that are available. What we talked about was some of the proper ways to use this, some of the ways to avoid the side effects, which include dry mouth and blurred vision if people get it in their eye. So it's very important that this agent be used on a daily basis, that it be applied to the underarms and blurred only, vision, and that it not be touch the eyes. Patient wash their hands after using it. Now, I'm always asked whether it can be used in other body areas other than the underarms. And the answer is it can be, but we don't have any data for that, and it is actually whether it can be used in other bodies. I also talked about some of the oral anticholinergic drugs, which we've been using for years. The primary one being glycopyrrolate, or Robenol, given in ascending doses, can be used for people with hyperhidrosis of any area. So it's exciting that we have some new options for treatment for this condition that affects so many people. And I am glad to have been part of the development of these products and be able to share my knowledge with the others.